Hi, I'm Dr. Matt DiDuro, and I'm the president of the chiropractic division of SoftWave Sales. Back in 2007, I had a 350-pound patient fall off the table, and I had to grab him. It dislocated my shoulder and tore ligaments in my wrist, because I was literally out of work for 3 years, had 2 more surgeries. The shoulder surgery was a complete success. My wrist surgery left me in pain for a decade. Every waking hour I was at a pain level of 5, and I could no longer push a lawnmower, I couldn't ride a bike, I couldn't adjust or manipulate with this hand. I had to sell my clinics in New York. My wife and I retired down here, and I started teaching at Life University, and I ran the functional rehab department. And I had over $200,000 worth of rehab equipment, and nothing helped my wrist. My career and my reputation has changed immensely by meeting John Warlick, our CEO and founder. And John Warlick was like, "Is there anything about your body that hurt?" He literally put me down on the table. He did a 3-minute treatment on my wrist, and I was literally pain-free for the next 4 days. I went back for 2 more treatments over the next 10 days. I was 90% better. I bought a device, and I didn't have to treat my wrist for another year. So I was like, John, if this can help my neuropathy patients, this is gonna be huge. This neuropathy pain is very debilitating. People can't work, they can't walk, they can't stand. All of a sudden, we started using it on all our neuropathy patients. And instead of 3 months and 24 visits, they were getting better in 12 visits over 6 weeks. So we cut the treatment time in half, and we nearly doubled their sensory nerve function in that same amount of time. And I thought, if I just showed these amazing transformations that these patients were having, everybody would get on board.
I want to record your first few steps.
Oh my gosh.
Cool. This is why I go all over the country to do this.
Every day, our SoftWave doctors are taking care of tens of thousands of patients with a non-invasive, non-drug, non-cortisone, non-surgical approach that's actually safe. To hear of a device that can not only diagnose, locate, and then treat an area, it sounds almost scientific. But that's what we're dealing with now. And SoftWave is transforming not just the practices, but the communities these doctors are living in.